95% of men finish every time. Only 65% of women do. That's not a small gap. That's a problem. Today, I'm sharing the 4 science-backed positions that actually work. No guessing, no frustration, just real research. Watch till the end. Hello everyone, let me ask you something honestly. Have you ever been in a close moment with your partner, feeling real connection and enjoyment, yet noticed she doesn't seem completely present with you? Maybe she likes the closeness, but reaching that final release doesn't happen for her. Or maybe it happens occasionally, but feels unpredictable, like you're searching in the dark. You're definitely not alone in this. Here's a fact that might surprise you. Clinical research shows that while 95% of men regularly finish during intimacy, only about 65% of women do. And when we look closer, fewer than 30% of women reach orgasm through penetration alone. That is a massive gap. So here's the main question. Is there a way to significantly improve her chances without endless trial and frustration? When a woman struggles to reach that peak consistently, it doesn't only affect her, it affects your confidence too. Frustration builds on both ends, and sometimes couples start believing this is just how things are. But here's the wonderful news. Science has actually given us a roadmap. Researchers have used 3D ultrasound scans and thermal imaging to measure how blood flow moves through the clitoral structure in different positions. And yes, some positions create a clear, measurable advantage. Today I'm going to share the 4 best positions for female pleasure backed by real peer-reviewed studies. Stay with me until the end because I'll also reveal 3 bonus methods you can use in any position. Before we begin, let me know in the comments where you're watching from today. I love seeing this community of men in their 40s, 50s, and beyond. For years, we've been sold a false idea. Movies, magazines, and locker room talk have created the belief that if a man simply lasts long enough, his partner will be satisfied. But here is the biological truth. Most women do not climax from penetration alone. Let me explain clearly. The majority of a woman's pleasure centers are located in the clitoris. Most people think the clitoris is only that small external spot. But the full clitoral structure extends several inches inside with 2 branches that wrap around the vaginal canal like a wishbone. This entire structure contains over 8,000 nerve endings, more than twice the number found in the entire penis. During arousal, much like an erection, the clitoris fills with blood. It becomes swollen, sensitive, and highly responsive. But in many standard positions, the angle of penetration misses steady contact with this structure. Many of those 8,000 nerve endings are not stimulated during typical movement unless the angle is right. This is not about luck. It's about biology, circulation, and physics. In 2022, researchers used high-resolution ultrasound imaging to track blood flow in the clitoral structure during different positions. They found that certain positions increase blood flow by as much as 38% compared to standard methods, and that blood flow is directly linked to arousal intensity and orgasm potential. Researchers have literally mapped this process. So let's begin with position number 4. This may not rank highest for direct physical pressure and stimulation, but it is powerful for another reason. I'm talking about sitting face to face. The biology behind it is fascinating. Sitting upright allows moderate clitoral contact, but its greatest strength lies deeper than that. The close body closeness and natural alignment created when both of you are seated build an environment where intimacy and arousal strengthen each other. When she faces you straddling your lap, there's natural pressure between your pubic bones. But more importantly, this position allows full access to emotional connection. Eye contact, kissing, whispering, and feeling each other's breath fall into rhythm. For many women, feeling emotionally safe and truly seen is the path to physical release. Oxytocin, the bonding hormone, increases during sustained eye contact and skin-to-skin contact, and that hormone directly boosts arousal. Here's how to do it. Try this on the edge of a sturdy bed or a chair with arms for support. You sit first, legs slightly apart for balance. She straddles you facing forward with her knees on either side of your hips or the seat. Both of you remain seated upright. Your hands should rest on her hips or lower back, offering gentle support without directing movement. Let her control the rhythm. The motion here is less about bouncing and more about rocking and grinding. She can control the depth, the angle, and the pace, adjusting instantly based on what feels best. This position is ideal for evenings when you want to slow down and focus on intimacy itself rather than intensity. It isn't about rushing to the finish. It's about the experience, the connection, and building arousal slowly and deliberately. One of my patients once described this position as feeling like true lovemaking rather than just having sex. And that emotional shift made all the difference in helping her relax and fully let go. Now let's move to number 3. This one is a hidden gem in clinical research. I'm talking about the coital alignment technique, commonly called CAT. If you've never heard of it, you're not alone. The biology of CAT is all about precision. It is a modified form of missionary, but instead of the usual in and out thrusting, both partners shift slightly higher so the base of the penis or pubic bone keeps steady sliding pressure against the clitoris. It is less about thrusting and much more about grinding in a shared rhythm. Think of it as a slow, intimate dance where both of you move together in perfect sync. What makes it so effective is the constant stimulation. In standard missionary, clitoral contact is often inconsistent, appearing and disappearing with each thrust. But with CAT, the pressure remains steady and continuous. A 2015 study found that women reported much higher arousal and satisfaction with this grinding method compared with traditional thrusting because the stimulation never stops. It builds gradually instead of rising and falling in waves. Emotionally, this position creates a deep sense of teamwork. It removes performance pressure because it is not about how hard or how fast you move. It is about discovering a rhythm together, moving as one. Both partners are equally involved and equally engaged. There is no demand to perform a certain way. You are simply moving together. Here is how to do it. Begin in a normal missionary position. Then shift your whole body upward about 2 to 3 inches so your chest is closer to her face and your hips sit higher than usual. Instead of thrusting in and out, rock your body forward and backward while maintaining full contact with her pelvic area. Your pubic bone should press and glide against her clitoral area with every movement. She tilts her pelvis upward to meet you. Together, you create a rocking, grinding motion that feels almost like slow dancing horizontally. I'll be honest, this may take some practice to find the rhythm. It can feel awkward the first couple of times. Don't be afraid to laugh, adjust, and communicate. But once you find that timing, once you settle into it, the stimulation becomes incredibly steady and intense. Many couples tell me that after mastering CAT, it becomes one of their most reliable techniques. Now we're entering the top 2, and these are the positions with the strongest research support. I'm talking about missionary with a pillow. Standard missionary is familiar, comfortable, and intimate. But here is the issue. The angle is often not ideal for clitoral stimulation. That is where this simple adjustment changes everything. The biology here is straightforward physics. Placing a firm pillow or folded towel beneath her hips tilts the pelvis upward by around 15 to 20 degrees. Ultrasound imaging studies have confirmed that this small tilt aligns your bodies so natural movement creates much more direct clitoral stimulation instead of friction mostly along the vaginal canal. That raised angle brings your pubic bone into steady contact with her clitoral area during each movement. A UCLA study found that women reported roughly 30% greater sensation and satisfaction from this one change. 30% from a pillow. It also increases blood flow to the anterior vaginal wall, where the G-spot is located, adding another level of stimulation. Emotionally, this position keeps everything people love about missionary: the close face-to-face intimacy, the ability to kiss, maintain eye contact, and whisper to each other. You solve the physical angle issue without losing any of that closeness. And when she notices you made this small adjustment specifically for her pleasure, it strengthens trust and emotional comfort. Here is exactly how to do it. Use a firm pillow, not one of the soft, fluffy ones that flatten easily. You can also use a folded towel or a small wedge pillow made for this purpose. Place it beneath her hips and lower back, not under her upper back. Her pelvis should tilt upward so her knees can open slightly wider. Then move into the standard missionary position above her. The key difference now is your angle. Focus on forward pressure rather than only depth. Tilt your pelvis slightly downward as you move to increase contact with her clitoral area. Her legs can wrap around your waist or remain bent with feet flat on the bed, whichever feels best. One professional tip: keep that pillow nearby. Don't make it a big production. Just blend it naturally into your routine. With time, it becomes second nature and the improvement in her experience will be clear. You can also test different heights. Some couples find a thicker pillow or even a folded towel works better depending on body proportions. Don't hesitate to adjust and discover what works best for your unique bodies. And now we've reached number 1. According to the research, this is considered the gold standard. I'm talking about woman on top face to face. Multiple studies confirm that this position creates the highest levels of clitoral blood flow and gives women the greatest control over their own stimulation. When a woman is on top, gravity works in her favor, allowing blood to gather in the pelvic area and increase engorgement. She has full control over three key factors: angle, depth, and rhythm. In the 2022 ultrasound study, researchers found that when women could adjust their own angle, clitoral blood flow increased by an average of 38% compared with positions where the man controlled movement. When she leans forward, her clitoris makes direct and steady contact with the base of your penis or pubic bone. This creates the constant rhythmic pressure many women need. The internal clitoral structure is also stimulated from this angle because pressure comes from above rather than sideways. Think of it this way: if you are pressing a doorbell, you want direct pressure straight on, not a light brush from the side. The better the angle, the better the stimulation. Beyond physical mechanics, this also creates a powerful mental shift. She is in control. She does not have to hope you discover the right spot. She can actively guide her own pleasure. And that control greatly reduces performance anxiety. Many women carry hidden pressure to climax quickly. When she is on top, that anxiety often fades away. There is also tremendous intimacy through eye contact, kissing, touching, and whispering. She can see that you are fully present. Here is exactly how. Lie flat on your back with a pillow under your head for comfortable eye contact. Keep your legs straight or slightly bent for support. She straddles you facing forward, knees on either side of your hips. Important detail: she should not sit perfectly upright at first. Have her lean forward so her chest is closer to yours. This creates the ideal angle for clitoral contact with your pubic bone. Your hands should rest on her hips for gentle support, not control. Let her choose the rhythm completely. She may begin with rocking or grinding rather than bouncing. And that is exactly right. That grinding keeps steady clitoral contact, which builds arousal most effectively. Encourage her to experiment with angles. Leaning forward versus sitting upright changes where the stimulation lands. Every woman's anatomy is slightly different. As she finds her rhythm, provide gentle upward support with your hips. Not forceful thrusting, just small lifts that meet her motion. Think of it as synchronized support. Here is a helpful tip. If she wants more leverage, have her place her hands on your chest or hold the headboard. If her thighs become tired, she can shift into a squat with feet flat instead of kneeling. If she is not getting enough clitoral contact, try placing a pillow under your hips and avoid thrusting upward aggressively. That can interrupt her rhythm and reduce the contact she is maintaining. Communication here feels natural. You can ask what feels best, leaning forward or sitting up more. Or say, show me the pace you like. Watch her body language. If breathing deepens, eyes close, or she increases pace, she has likely found the right spot. Your role is to stay present and let her lead. Now, no matter which position you choose, I want to give you 3 bonus techniques that work in every case. Technique 1, the angle adjustment. Research shows that even a half-inch change in hip position can increase clitoral contact by 20 to 30%. In any position, try tilting your pelvis slightly upward. If you are on top, engage your lower abs and tilt your hips so your pubic bone points higher. It is subtle, but it changes the angle completely. You can also try shifting left or right. Every woman's anatomy is unique. Think of it like tuning a radio station. Technique 2, the shallow focus. Deeper is not always better. The first 2 to 3 inches of the vaginal canal contain the highest concentration of nerve endings. Instead of deep thrusting, try shallow focused movements that keep stimulation near the entrance and along the front wall. When you combine this with steady clitoral contact, you are stimulating 2 key areas at once. A 2019 study in the Archives of Sexual Behavior found women reported significantly higher satisfaction with shallow rhythmic movement compared with deep penetration. Focus on quality and consistency of contact, not depth. Technique 3, the combination approach. Research shows that combining penetration with direct clitoral stimulation can increase the chance of orgasm by up to 70%. That is a huge difference. This may mean encouraging her to use her own hand during intimacy. It may mean you using yours if the position allows. There are also small external vibrators designed for couples that fit comfortably between both bodies. Some men feel that using a hand or toy means they are somehow not enough. Let me be clear, that is ego, not physiology. biology. Anatomy simply requires this kind of stimulation for most women. Think of it as teamwork, not inadequacy. Your goal is her pleasure, and if adding direct clitoral stimulation makes that more likely, it is the smart and caring choice. Now here is the truth. None of this works without communication. But I also understand that talking about sex can feel very awkward, especially if you have been together for years and never had these conversations before. So let me give you a simple framework for making it comfortable instead of uncomfortable. Timing matters. Do not bring it up during intimacy. Choose a relaxed moment when both of you are calm, maybe after dinner, during a walk, or while winding down before sleep. You might say, "I've been learning about ways we could make our time together even better. Would you be open to trying some new things?" Present it as exploration, not fixing a problem. During intimacy, keep communication simple and positive. Ask, "Does this feel good?" Or more like this, "Should I adjust?" Or, "Show me the pace you enjoy." Watch her body language. Changes in breathing, muscle tension, and the sounds she makes all provide feedback. Some couples use a casual 1 to 10 scale where she can say, "That's an 8," or "Try adjusting, that's a 6." This makes feedback feel cooperative. And finally, normalize the fact that this is a learning process. Say something early like, "We're exploring. It may take a few tries to learn what works best for us." This removes the pressure for everything to be perfect the first time. Now, let me also give you realistic expectations about timing, because I don't want you to believe this will be an overnight transformation. The first time you try one of these positions may feel awkward. You are learning new movements and angles. That is normal. Don't expect perfection, expect discovery. In weeks 1 and 2, you will begin noticing which positions feel most natural for both of you. This is information gathering. In weeks 3 and 4, the breakthrough usually happens. Movements feel smoother. She has learned to guide the angle and rhythm. You have learned to read her signals. Communication becomes easier. By 2 to 3 months, most couples report major improvements. Not only orgasm frequency, but overall satisfaction and connection. Anxiety is replaced by confidence and playfulness. One patient told me it stopped feeling like a test and started feeling like an adventure we were sharing together. Here are a few important cautions. Some positions can be difficult if either partner has knee pain, hip flexibility limitations, or lower back issues. Listen to your body and make adjustments. Pleasure should never involve pain. Certain medications can affect arousal, especially antidepressants and blood pressure medicine. If you have tried these techniques consistently for several months with ongoing difficulty, see a doctor to rule out possible causes such as hormonal imbalance or pelvic floor dysfunction. And emotional safety is essential. If there is serious anxiety, unresolved conflict, or lack of trust, these physical techniques will not be enough. Physical and emotional intimacy are closely connected. So gentlemen, here is my challenge to you. Try just one of these adjustments this week. Choose the position that sounds most appealing or least intimidating and give it an honest attempt. Which one are you most curious to try? Let me know in the comments below. Thanks for watching.